Thanks, everyone. I'm so excited to be here, and I'm going to be kicking us off to talk about the next wave of innovation and technology and how we can make sure it's an ethical one. So I think the first thing that we all maybe need to acknowledge is that we are in a relationship with our technology. You may not have realized that this is the case, but if you're like most people, the smartphone is the first thing you look at when you wake up. It might be the last thing you look at before you go to sleep. You certainly touch it probably more than your partner at this point. If you are like most of us, you have probably had a philosophical conversation with Siri, or at least tried to trip her up a little bit. And it gets even more complicated when our technology is embodied. So if you have a Roomba, you may dress it up. If you're like most people, you've probably given it a name, and Rosie seems to be the most popular name for Roombas. But it doesn't take much for us to attribute some kind of intentionality to technology, whether it's some movement or something that looks like a face or some gestures. We attach to it. And that relationship is just going to get more and more complicated. It already has. And like so many things, the pandemic and the time period that we're in has pushed that forward. So this is Tommy, a nurse robot that's filling in the gaps between doctors, nurses, and patients, first in Italian hospitals and now globally. If we think about how we have this need for connection and being together, and how that's much more challenging now for a lot of people. We've seen the rise of not only virtual therapy, but chatbots like Replica, where people are actually thinking like, hey, this doesn't replace people, but it fills something in our lives that we need right now, and that's meaningful. And certainly, we have these relationships with technology, whether it's simply an app on your phone or something that's more embodied, like a personal assistant or a bot. But the problem is a lot of these relationships are pretty one-sided, right? We are in maybe what might be thought of as a narcissistic relationship. We know what a good relationship is. That's what guides our moral compass. We know we have to set boundaries. We know what constitutes a meaningful interaction. But right now, sometimes our relationship with technology feels kind of one-sided because because of this idea that we are sharing so much with technology and we don't know how that's being used. And so what I wanted to talk about a little bit today is introduce a new way of thinking about ethics that seems to be a bit more practical, intuitive for those of us who have any kind of human-to-human relationships in our life. And I kind of base this on care ethics, which originated with Carol Gilligan and Nell Noddings back in the 80s and 90s. And they were looking at how do we, in our day-to-day lives, create moral responsibility and decide what's ethical behavior. And a lot of this is how we manage our relationships, our responsibility to others, our capacity for compassionate response, what kind of boundaries we negotiate, what kind of commitment and reciprocality that we have in that relationship. And so there's lots of different models we can look at for relationships. And I think, we can think about, the kind of intensity that we might feel in love, or how we communicate with each other. But one model that I use a lot is thinking about just our relationships as we kind of progress through various stages. So technology can be in this initial courtship phase, pretty, showy, trying to entice us in, but feels too fast, right? It's as if we got into a relationship with somebody and said, hi, hello, why don't we get married right now? Or in the case of AI, you look like a thing and I love you. It goes too fast and it seems like it's not balanced. We know there's all kinds of shapes to relationships, whether it's a best friend or a family member or a beloved pet. But a model that I often turn to is Mark Knapp's model of empathetic communication, where there's 5 steps to building a great relationship and then 5 steps to the unfolding and disintegration of a relationship. But today we're going to talk about the 5 steps to getting to a good relationship and what that might look like in the context of technology. So let's start with phase 1, initiating a relationship. And I'm going to imagine that, think about if you were starting a relationship in real life. Maybe you would know a little bit about a person. Maybe somebody would have told you, we have a new neighbor, we have somebody new in our community, you might get an introduction. Often with our technology, we don't get that kind of background. It seems like the technology knows a lot about us, but we don't know what it knows or how it came to have that knowledge. So what if we had a bird watching chatbot, I'll call Robin, and who just says with transparency, it looks like you're searching for a hot duck in Central Park, which was a big deal a year or so ago when a mandarin duck landed in Central Park in New York City, if you followed that at all. So we'll use that as our example. And ask simply, do you want to read more about it? So there's a kind of transparency to this. And note that there isn't something right away locking you in to terms and conditions that will exist forever. GDPR has kind of started us on this track, but I think we have a long way to go to replicating that back and forth and negotiation that we have in a good relationship. So let's move on to phase 2, experimenting. So in a human-to-human relationship, we experiment a little bit after we get to know each other. We learn a bit about each other. We try out new things together. And we ask what's okay and what's not okay. So here Robin might ask, is it okay to learn about your location? And here's what I'm going to use that information for. And might go even further and say, let me know if this is okay and how long you feel comfortable sharing this information and letting me know that, this is negotiable and later on you can change your mind. And that is also okay. That's something that's not really built into our technology, but it's kind of a common sense we have about caring relationships. So if we quickly move on to phase 3, this is like the fastest relationship ever, right? It's intensifying. And in real life, when we intensify our relationships, we go through a lot of different tests, right? There's like a triangle test where you try to potentially make a partner jealous. You test whether this behavior is acceptable or that behavior is acceptable. And so when we're thinking about our chatbot, we may have some of these tests as well. But for the sake of time, we'll move on to phase 4, integrating. This is the phase when we come a bit closer together and we are finally thinking of ourselves as kind of a team or a pair or whatever the relationship might be. And so in this case, we might say to our chatbot, Robin, well, please don't import my sleep data into the app. I want to set some boundaries here. I know we're coming together and we might be known as a couple or a pair or a partnership or a team, but I want to put some limits on that as well. And then finally, the goal of most relationships is a strong attachment, a bonding, a way to come together. But relationships go through various phases and ebbs and flows and need to be able to accommodate change and challenging situations. This is something technology is not too good at, right? Any of us who have been followed around by ads is a great example of how technology remembers our recent past and puts us in this kind of tech time warp and doesn't really let us grow and change and evolve like we might have otherwise. So what could this look like? Well, maybe we could say, Robin, our birdwatching chatbot, it's time to move on, and maybe we can try something new. Maybe that's together, and maybe it's not. So I think, we can see how when we're talking about technology and ethics and emotional connection and our relationships, it's complicated. It's not a problem to be solved because we're complex, emotional human creatures, and this isn't something that's going to be we'll be able to automate or program into our machines, but in fact it's something that we can build gradually and intuitively based on the kind of moral ethics that we have built into some of our relationships. So I hope you will enjoy the rest of the day and these amazing speakers who are going to touch on all of these issues, like how we can make technology more inclusive, how we can make it more fulfilling, and how we can make it more ethical. Thanks so much for inviting me and sharing the first few minutes of this journey with me.
Hi, that was so powerful. Thanks so much, Pamela, for sharing how we can leverage relationship principles as we design technology so that it is in service to the human experience. And I do hope that we see more technology being designed and built that considers for our emotional connection to technology, ethical responsibility, and how technology can impact us. I'm Ariba, your facilitator for the session. I'm the Director of Innovation at the Ad Council. I'm a biomechanical engineer turned innovation and product leader focused on creating social impact. I design inclusive and equitable human-centered experiences, products, teams, and dialogues where curiosity, resiliency, and experimentation can thrive. And I'm just so thrilled that we're having this conversation right now. Creating equitable and inclusive technology has always been an important lens for how I approach my work and everything I do, because we all have different lived experiences. Something that I learned really early on in my childhood, growing up as an immigrant in a family where we leaned on food stamps, trying to be a kid while needing to wear hearing aids in school, and discovering that my family is perceived as immigrants. Those are the things that were part of my lived experiences. And knowing that, it reminds me that all of us have different lived experiences, and none of us can know that without talking to each other. And that's why it's so critical to be mindful of whose perspectives and lived experiences are we excluding. That should actually inform the work that we do, because we're doing it in service to them. And a memory that stays with me is my junior high school guidance counselor had advised me to not pursue science and engineering because I'm half deaf. And being an adult, now I can reflect back on that memory, and I'm like, oh, she made assumptions about my capability based on my disability. And ever since then, I knew it was important for me to not make assumptions about the needs and abilities of others, but rather include them in the design process so that the users are informing the products and experiences that are being created for them to use for their relationships. And, we talk about emotions, empathy, and human-centered work a lot in our industry because it's so critical. But sometimes they kind of become like buzzwords in our industry, and we forget what it really means to put it into practice. So today, we'll hear from 3 incredible speakers that will share how they keep the human experience at the center of their work to ensure that it's inclusive, equitable, and ethical. The way today's session will work is we'll hear a bit about the work that they do first, and then we'll jump into more of a discussion. So first, let's kick it off with Eric Coley, the founder of Iona Therapy. Eric, We're kind of in a great moment where asking for resources and conversations around mental health has been normalized. But just because it's normalized, that doesn't always mean that the access to mental health services is democratized. We'd love for you to share with us how you're thinking about leveraging technology to create a more equitable access to mental health.
Sure. Hi, everyone, and thank you for having me. So, a couple of years ago, one of my dear friends, who's African-American in Los Angeles, shared with me that she could not find access to a counselor. And it's not that she couldn't find one, it's just that the one that she found, she felt as though as long as she was Black, a Black woman, she would have to be happy with that, right? And so there was the notion of you have to settle with a rather low standard, as long as the person looks like you. And I, being a bit of a fixer, I said, well, let me see if I can help out and see if we can get you with a counselor who can possibly help you. And in doing so, what I've learned was that there was a rather common issue that was going on in the US that pertains to people of color, minorities, who are having a hard time having access to such counselors. And in doing some research, I learned that there were around 56% of counselors who, as hard as they tried, they weren't well understood by their patients. And what that caused is that it made it hard for them to abide by the prescription that were being sent to them. But also, and more importantly so, there's a lack of cultural competency that's being acquired by doctors of all, by healthcare providers. And what it does is that it makes it very hard for minorities who, those that do try, and we know that not too many of them try because of stigma and cost and the lack of insurance, but those that do try end up having to face an environment that's not as safe as they wish it were. And so as a result, what's happened is that minorities only use therapy services at about a third the rate of white Americans. And it's a sad fact, right? We are dealing with a situation where minorities have ostensibly been facing challenges, whether we are talking about socially, politically, or economically. And they still aren't able to find the help that we as human beings ought to be able to make available to them out of pure decency. And so what we did is we thought of looking deeper into the issue. And we ask ourselves, well, what is it exactly that's causing them to not being able to have access to counseling? Well, to even starting off, to even having the will to say, I think I need help, and having the safe cultural setting that could make it okay for them to go, I need to go and seek a counselor. For those that do try, which it is a fraction of those that need it, we realized that there was a high level of stigma attached to the culture, but also the resources weren't being made available enough for them to be able to find that. So what we did is we thought of a solution, and we thought of a product called Ayana. And what Ayana is, it's an online platform, and it matches you with counselors based on race, gender, ethnicity, and religion. It's a very easy concept that we've designed, and what it's enabled to do is the following. It's a safe platform where we've very intentionally chosen to put together a list of counselors that we know will reflect the nature of our audience. And the point of emphasis that we looked for were, again, race, gender, ethnicity, religion, but also with a high sense of intersectionality. What I've learned, and you can hear that I have an accent, so what I've learned in this country is that there's an expression that I've dubbed, and it's called ethnic self-delineation. And what it means is that generally services tend to be offered from one community to the same community. we don't see what I think is needed, which is intersectionality. And so what we did is we very emphatically went and looked for people that were able to reflect a much more progressive cultural agenda, right? And thus far on Ayana, we have around 200 counselors, and we've been able to recruit around 100 new counselors a week over the last month, as it pertains to how dire situation we know we've been facing in this country of late. And so this is a small sample of some of the individuals that we have on the platform. We have up to 12 languages that are being offered on it. We estimate being able to have around 3,000 to 4,000 of them by the end of next year. We've developed a concept where we are empowering the users to dictate exactly who we are, how we are, and what we should do to honor their very needs. So it's a very user-friendly product. We wanted to make sure that we know that there's a proclivity for our users to want to not use the product because it offers access to something that's quite new. And I'll say I'll go even farther and say the following. When you've been neglected by the system for so long, you almost have a self-fulfilling prophecy where you'd want us to not give you what you need just so you can find solace in having been further disappointed. It is easier for you to say, well, see, you've done what's been done to me. I get chills talking like this. So we want to make sure that we can gain your trust. And what it means is that we have to make sure that we look at you in the eye and we abide by a sense of cultural humility. And to us, it matters most than anything else. So sorry. And in doing that, it made it a lot easier for us to be able to, what I call, enter into one's room and saying to them, we know we have a high ask. And it is to open up to us. But having those sense of values being discussed made it easier. Forgive me. This is a personal story as well. I've lived it, so I care. All right, next. We've been able to garner a bit of success of late. We actually launched a couple of weeks ago, but we've been using the product in private beta, and this is a small sample of customers that we've been able to work with. We currently have close to 50 companies on the pipeline. We've been talking to the city of San Francisco. Walmart also contacted us, the city of New York, a few universities. We were named top 10 by Fast Company in wellness and innovation recently. So the future looks bright to us, but again, to me, it doesn't mean anything until we show honesty, right, and regard. I am so grateful to have a team that cares. These are some of the individuals. Ahmad has spent over 20 years in healthcare, leading product and engineering. Erin Liddell is our head of ops, a fabulous individual who she sounds almost the way I do, so that tells you a lot. And Dr. Kim, who's joined us back in March, also quite erudite in the industry. Dr. Wee Chin, who is the first advisor that I've somewhat stalked to join the company a year and a half or 2 years ago, actually. And he led the way at the beginning, and he helped me get Dr. Grills, who's at the intersection of ethnic studies and counseling, who's actually known for de-Westernizing ways of offering counseling. And Gina Belafonte, who's our social activist for Yana. All right, so what does the future look like for us? My hope is this, and it is a rather ambitious hope. My hope is to be able to undo the way the system is set up and reattribute power to the users. And it may sound a tad cliche, but I find a bit arrogant when we say to someone who's been neglected that we know what they need before having spoken to them. We are here to listen, to hear. That's it. You hear, you listen, you put your ego aside, and then you get to work. And so the goal for us is to do this well. We also want to make sure that because we happen to be sitting at a corner that has been untouched mostly, that we use the data ethically and 2, 3, 5 years from now, do twice as good a job as we've done in the past, right? And that means collecting a team of individuals that we know have a high sense of ethics, but also have in mind the fact that that's who we fight for. And that's it. That's Oyana. And Oyana in Bengali means a mirror. So that's the sentiment of the company. Thank you.
Thank you, Eric, for sharing your passion and story with us. I think I can speak for everyone that's in their own Zoom boxes at home. It's so evident that your lived experience has informed how you listen and learn from your users, allowing their input to really inform the incredible and critical work you're doing. We're excited to see the future of Ayana. I'm Bengali, so I love that your company's name is actually Ayana, which is very part of my own language. Next, we'll hear from Laura Hamill, Chief People Officer and Chief Science Officer at Limeade Institute. Laura, you are an organizational psychologist focused on creating more human places to work. Can you share how you're thinking we can leverage technology to help create more human work experiences?
Yes, awesome. Thanks so much, Ariba. And I really appreciate, Ariba, how you shared your personal story, and Eric, how much you care about your work. That's really, it could really sum up what I'm saying today. It's about the real human connection. It's about treating employees like human beings. So I work at Limeade. We're an employee experience technology company. I'm also one of the co-founders, and I am an organizational psychologist, so psychology applied to work. I'm excited to talk with you today about how work really needs to be better and how software can help our work be better. So what we know is that employees around the world are stressed. We're struggling, we're burning out. And that was true before all the crazy stuff that's been happening in the world. It was before COVID-19, all of the racial injustice that's come to the forefront, all of the political unrest. So all of these things that have happened in the world are really just exacerbating things that are already true. And what we know is this has affected our personal lives, but it absolutely has affected work. And we are very much clear that we have to change the employee experience. So it's time to rethink it, right? It's time to do something different with the employee experience. And employee experience is really about how everything that happens at work, all interactions, the big things and the small things, affect how you feel about your work. So I think the word feel is one of the most important things. And it's kind of what we were already experiencing with Ariba and Eric, this idea that your emotions are what's important. How you feel about your work is what's important. So that's what we're really focusing on at Limeade through technology. So with Limeade, every employee knows their company cares. That's our brand promise. That's really what we're focusing on, is that feeling of care. So how do you do that? We focus on it in 3 different ways. The first way is focusing on the whole person. And what we mean by that is caring and supporting people as whole people. So we think about their physical well-being, their emotional well-being, their financial well-being, and their work well-being, and really focus on people as whole people. In addition to that, we think about the whole company. So it's one thing to just care about people as people. What if you had the whole company rallying around that? What if you had managers, teams, leaders, all really surrounding the person and very authentically and consistently supporting them as human beings? And then on top of that, the whole ecosystem all around. What if all of your partners, all of your resources were all aligned to show that consistent care? So that's really how we go about thinking about the software and how we deliver software. What's the message we want to send, that consistent care? But why do we do that? Why do we focus on care? So this that I'm about to show you is really just a tiny little snapshot of some of the research we've done in Limeade Institute. But it gives you a little bit of a feel for why we focus on this. So this particular research study basically shows that when an employee feels that their organization does care about them, they have higher levels of well-being, employee engagement, and inclusion. When they feel like their organization doesn't care about them, the percentages are much lower. So this is percent favorable against well-being, engagement, and inclusion items. So there seems to be something really important going on here with this idea of care. And care, it sounds like a kind of easy, simple word. There's actually a ton of research behind it. It's called organizational support theory. And there's really solid research that's been done for a long time around what organizations can do to reinforce, encourage, and support their employees. So not only did we find that care was correlated with well-being, engagement, and inclusion, we also found that care was correlated with intention to stay and likelihood to recommend your company as a great place to work. So when an employees feel like their organization does care about them, they were 10 times more likely to recommend their company as a great place to work compared to those employees who didn't feel like their organization cared about them. So that's the why. That's why we focus so much on care. So through our software, we are a software company, through our software is how we operationalize that. So the role of technology is important. It really allows us to reach employees. It allows us to create a sense of community, to recognize them, to listen to them, to really show employees that they matter. And I guess what you could say is this is how an organization can actively demonstrate care, right? Through software. Another kind of idea here is that whole person, whole company, whole ecosystem. We really help communicate and send messages of what's important in an organization. We help people actually improve in these areas and emphasize and get better in some of these areas too. So by showing these kinds of messages, by really communicating regularly and emphasizing these kinds of activities, you can really authentically show to your employees that they matter, that you care about them. So one quick example that I wanted to share with you was one of our customers, Brunswick. Brunswick manufactures marine vessels, and they are marine technology innovators. And they have about 9,000 employees, and most of them are in manufacturing. And so they use our software and are really able to get to all of their employees, even if they're on the manufacturing line. So that's one really important concept, is being able to reach people. But through that, these are some of the things that they do. So for example, activities to support emotional well-being, or teaching managers how to communicate with their teams, or even ways to be safe during COVID, or linking to telehealth. This is just a small sample of what an employee at Brunswick would experience by being on our platform. So there's all different other ways that they actually bring this to life. But the idea is there's a place where people go to know that they're cared for, that they're valued, and really that they matter to the organization. So really, I hope a couple key takeaways that you get from this is it really is time to rethink the employee experience. There's nothing like the catalyst we've had of the year of 2020 to help us see that things need to be different. And it's so important when we think about software and what we're trying to do at Limeade, caring about people as human beings. And you can't just have the intention to care, you actually have to do it, right? You have to operationalize it and you have to actively show you care. Thank you.
Thank you. Thank you, Laura, for reminding us that work is not just about getting things done and KPIs, but how we can actually reimagine work and create a more human work experience using software to create a sense of care for the individual, company, and ecosystem. I think we need that now more than ever. Next, we'll hear from Madeline Dangerfield-Cha, the CEO and co-founder of Mon Ami. Madeline, you are working on meeting the needs of the largest population we have. There are 71 million baby boomers in the US. Can you share with us how you are designing products and experience in a way that meets the needs, challenges, and experiences of older adults?
Thanks so much, Ariba, and to the panelists who've come before me, Laura and Eric. Just so inspiring. I'm really honored to be here today. And I'm going to start with a story. So on your screen, you will see my friend, Mon Ami, Ralph. Ralph is a retired French professor at Stanford. He also has dementia from Parkinson's disease. In 2018, I started helping him write his memoir. His wife, Claudie, saw a post I made on Nextdoor, the local neighborhood social network. Once a week, she put out cookies in a teapot with matching cups and saucers. Ralph sometimes searched for the right words, but he still managed to transport me to France on the hunt for freshwater mussels, to ski slopes in Lebanon among the cedar trees, to a sabbatical in China where Claudie was teaching French, but really her students wanted advice on how to marry an American. Our time together was the highlight of my week. Ralph is one of hundreds of seniors Mon Ami has had the honor of serving in the last 3 years. Most came to us through a caregiver, a spouse or an adult daughter, because of dementia due to Parkinson's disease, Alzheimer's, or other cruel thieves of personhood. Meaningful, long-lasting connections are crucial for these individuals when the world can otherwise be completely overwhelming. So we found other students with the same energy and passion who were matched with seniors for painting, video gaming, language lessons, and long walks. We built administrative software and a mobile app to handle screening, background checking, and matching of new companions, like Uber or Lyft for senior companionship. When my co-founder Joy and I graduated from Stanford's business school, we made ending loneliness our full-time jobs. Her background is in aging and healthcare. She's worked for the World Health Organization's aging team in Japan and has been a hospice volunteer since high school. I was raised by a single mom and my maternal grandmother. Intergenerational connection is in my blood. We did over 10,000 hours of visits on this platform, and we're just starting to take off with coverage from Good Morning America, the New York Times, The Guardian, and then COVID hit. Of course, we all know the sudden and terrifying prospect for seniors, particularly those in nursing homes where more than half of our clients lived. Though we couldn't visit in person, we threw everything we had into virtual support. Video calls, virtual chair yoga classes, errand runs for groceries and other essentials. But like everyone, we were scrambling and afraid. Clearly, in-person visiting with seniors would be out of the question for the foreseeable future. Our revenue had dropped to zero overnight. It seemed our mission was doomed just when it mattered most. Then we got a call from the San Francisco mayor's office. One of the staff members there, Claire, had seen our app in action because her partner had been a companion with us pre-COVID. San Francisco's dozens of senior serving organizations were underwater. They were receiving hundreds of requests per day for prescription pickups, food insecurity, and extreme isolation. But staff had no ability to track and manage these requests, let alone fulfill them with volunteers. That's where Mon Ami technology came in. Mayor Breed held a press conference announcing our partnership and posted a link to our volunteer application on sf.gov. Our partnership got over 1,000 volunteers onboarded in the first week. At the time, it didn't feel like a pivot. It felt like a simple calling. We had the technology and the willingness. It was not time to be strategic. It was time to just jump into action. Claire had opened the door to so much need. We set to work in partnership with nonprofits and city officials, processing requests, posting them to volunteers nearby, running rapid trainings, updating safety protocols. Our team pulled a lot of all-nighters and weekends during this period, but it meant that we could offer so much support. Robert and his partner Jim ran low on their stroke medication. It was picked up and dropped off at their apartment within 3 hours. Cantonese-speaking volunteers went to specialty markets and swapped recipes with a mostly Chinese community housing project. Volunteers donated old tablets and iPhones, helping seniors to join Zoom calls from a safe distance. Of course, our technology needed some updates to support this mostly remote and virtual work after 2 years of designing and developing around the in-person experience. For example, all of the heartwarming photos you've seen so far in this presentation came from actual visits. After every session, companions would submit a visit story, photo, and description to be shared automatically with a caregiver. Social workers and other staff at our nonprofit partners now were asking for the same level of visibility after volunteers made phone calls or completed an errand run. For example, one volunteer, Daniel, was unable to reach his senior match, Rhonda, after repeated calls and even showing up at her apartment for a delivery. Daniel notified Rhonda's supportive organization, Open House, where a social worker was able to connect to Rhonda's neighbor, who discovered that Rhonda had fallen and wasn't able to reach her phone. Rhonda was rushed to the hospital. Information from these volunteers is saving lives. So we needed to update our recap process to make it as simple and straightforward as possible for volunteers to complete and for senior serving organizations to ensure that no one slips through the cracks. Similarly, this higher emphasis on virtual connection posed a big conundrum. Of course, we'd love for all of our seniors and volunteers to connect on Zoom or FaceTime, but given access barriers to technology, it's just not feasible a lot of the time. So we've integrated a phone system directly into our app that allows for seniors and volunteers to connect just by dialing our main number. The system recognizes the number they're calling from and connects them automatically to their match without ever revealing their private personal number. It allows us to keep everyone's information safe while still maintaining those direct, long-term connections that have been our mission from day one. And it provides passive, automated reporting. Social workers and other staff can see how many calls have been completed and how long they lasted, so they know automatically if a senior hasn't been in contact recently. Looking back now, this move seems like an obvious pivot for us from direct service delivery to an enterprise SaaS provider, enabling frontline organizations to support their most vulnerable through these unprecedented times. We've gotten interest from many more cities and municipalities who share these challenges, and we're working with dozens of aging-focused departments and nonprofits around the country. But as I started this presentation, and as all of us have reiterated here today, technology itself is not the mission. People are. So many of our contemporaries in Silicon Valley put technology at the center of the universe, like this infamous quote from Arthur C. Clarke that should be popping up on the screen. Any sufficiently advanced technology is indistinguishable from magic. But I don't think that's the point. The technology itself is not the magic. Instead, let's dream of more tools that get out of the way, that melt into the background as social workers and first responders and young, healthy people do what they're meant to do. They show up for each other. This looks different today than we dreamt it would 3 years ago when Joy and I were starting on this journey. As you can see here, my chats with Ralph and Claudie are virtual or from a safe distance on their patio, but that doesn't mean that they mean any less. In fact, as we get through this together, they mean more than ever. Thank you.
Madeline, can we talk about the level of courage and resiliency it must have taken to do what you just did, to turn that moment of so much uncertainty to a calling and help those that needed it the most? Thank you so much. Thanks so much, Eric, Laura, and Madeline, for sharing how you honor the human experience in the work that you do and the decisions you make. We are kind of out of time, so we'll do one closing question and would love to hear from every speaker on this. You know, you've all articulated how you are maintaining equity and inclusion and ethics in the forefront, and would love to kind of paint a future vision for our listeners, our Zoomers today. You know, what are we building towards? And what do you think it'll take for us to get there? What do you want people to do today? Anyone want to take it away?
I'll start. I mean, for me, I think what it should or could look like would require the involvement of the people that we are trying to help. And there's got to be a level of sincerity. Like, what exactly are you here for? And let that dictate exactly the format, right? Let that be the infrastructure that can set guidelines and rules. And that level of sincerity can't be achieved or obtained unless you've had the humility to listen again, to listen, to set aside your own particular needs egotistically or not. And I said this yesterday, I think I'm a dreamer's dreamer, and I feel as though it is quite achievable, but we need to be able to be ready to listen. And I think we should be okay.
I think I would connect back to Pamela's talk a little bit and say it's about relationships, right? It's not really about the software so much. It's about the kind of human relationships we're creating. If you think about Eric's talk, Madeline's talk, mine too, relationships at work. How are we creating real human connection? How are we creating meaning? How are we creating trust? So I really think it's less about the bells and the whistles and the features, and it's more about the feelings, the emotion, the relationships we're creating.
And I guess in my vision for the future, I think it's been quite easy in speaking with a number of older adults and young people in the last 6 months to let the larger social narrative of how destructive our current situation is to dominate a sense of to occlude hope, to take over and feel like we're just living in doom and gloom. But the only antidote that I've seen to that is this authentic connection and really accepting the responsibility that we have for each other. That we are not burdened by being in community. We are we can only thrive because of it, and any pain or grief that we are entrusted with, it's our duty to honor it and to carry it forward the best we can.
Thank you so much for sharing. I think that wraps up our session on really exploring ethical, equitable, and ethical, equitable technology where we could be mindful of emotions and inclusion. Thank you so much for joining us.